we have these choices when we hit these nodal moments in life where we can't go further, where the medications are not working any longer. So that's who comes to me. They're already coming to me ready for that change. They've tried everything. They've done all of the therapy and they've made good progress, but there's still the missing piece.
Welcome to the MindHealth360 Show. I'm Kirkland Newman, and if you, your loved ones, or clients suffer from mental health issues such as depression, anxiety, insomnia, poor memory, poor attention, mood swings, exhaustion, etc., I interview the leading integrative mental health practitioners from around the world to help you understand the root causes of these symptoms, many of which may surprise you and suggest solutions to help you heal. If you like this interview, please do subscribe and forward to others who might find it helpful. If you want further information, please go to www.mindhealth360.com or find us on social media. So Dr. Leslie Korn, welcome to the MindHealth360 Show. I'm thrilled to have you here.
Thank you.
I first came across you at the Integrative Medicine for Mental Health Conference in San Diego in 2019, and you were talking about the intersection between trauma and nutrition. And I thought that was so prescient and so fascinating. And I hadn't heard anyone talk about that for ever. And I thought, this is really the sweet spot. And so I'm really excited to talk to you because, you've written, I'll give a brief description of your amazing life, but the two books that I've been working on are Rhythms of Recovery and Nutrition for Mental Health, and both of which are absolute encyclopedias of all the things that you can do to improve your nutrition for mental health, but also the different approaches to trauma and all the different techniques that you can use to sort of heal and address trauma in conjunction with the biochemical and the nutrition. So to me, this is really powerful because there's a big movement at the moment in terms of trauma and progress in trauma treatment and somatic therapies. But to me, there needs to be a combination with the biochemical aspects, and especially with nutrition, diet, and gut. And I think you do this beautifully. You bring them together. So I'm so excited to have you on the show and discuss this with you. So just in terms a little bit of your amazing background, you've got a PhD, and basically you've got a PhD in behavioral medicine, an MPH from Harvard School of Public Health, and an MA in cross-cultural health psychology from Lesley University. You specialize in the use of integrative medicine in the treatment of stress, trauma, cognitive function, and chronic physical illness, and you've been in clinical practice for over 40 years. You began your training 45 years ago in the jungle of Mexico and completed it in the jungle at Harvard Medical School in the departments of psychiatry and public health. So you're a licensed psychotherapist, national board certified in clinical supervision, certified in functional nutrition, and board certified in polarity therapy, body work, and massage therapy. You also run a very vibrant private practice working with clients to improve mental health and reduce or eliminate medications, so deprescribing using natural medicines. You also have a training course, and over 30,000 health professionals have completed your program in integrative medicine and nutrition, and you supervise and mentor integrative clinicians. You also pioneered somatic therapies for the treatment of mental illness at Harvard Medical School as a clinical fellow and instructor in psychology and religion, and implemented wellness, multicultural, and addiction recovery programs in 10 languages. And you now direct the Leslie Korn Institute of Integrative Medicine. You're the founding director of the Center for Traditional Medicine and director of research and education at the Center for World Indigenous Studies, which is a not-for-profit advancing the rights of indigenous people worldwide. You're finally the author of 10 books, including Nutrition Essentials for Mental Health, Rhythms of Recovery, Integrative Medicine for the Treatment of PTSD and Complex Trauma, The Good Mood Kitchen, Natural Woman, and The Rainbow Blueprint, a clinical guide to integrative medicine and nutrition for mental well-being. So Leslie, you have an incredible background. And so tell me a little bit about you and how you decided to combine these two interests in trauma and the biochemistry of trauma and nutrition.
Well, I began my work in the jungle of Mexico. I arrived in 1973, and I was very fortunate to get sick with absolutely everything that was possible to get sick with. Um, and you'll hear I've got some dogs, some of my healers in the background. Um, and it thrust me onto a path of understanding how to regain health and restore health or stay healthy with all that nature had to offer. And that, so much of that was herbs and food, particularly in the jungle, and some seafood since we were on the ocean as well. And so there were no doctors, no nurses, no roads, no electricity. I was just happy as a clam, living in the middle of nowhere, really. But it was somewhere where I had the opportunity to meet healers and shamans and people that helped guide me on the path to understanding how nature heals and how one of the things nature gives us are, as I say, medicinal plants, herbs, substances from the earth that also sprinkle from the cosmos, and foods that alter our consciousness, alter our chemistry. And from there, I studied body work and began working with people's bodies and the pain that they brought to me. And that led me to the study of psychotherapy. And so, in many ways, as you so kindly mention in my work, I would identify really three pillars of talk and touch and nourishment, both emotional nourishment, spiritual nourishment, but also the nourishment that we give to our brains and our bodies. And one of the things that I learned living in this particular indigenous culture that set the groundwork for my study of indigenous cultures worldwide and the role of nutrition, the role of food and herbs, is that every culture is quite different and our biochemical needs are quite different. We may all suffer from a particular trauma or set of traumas, but what we need biochemically and through nourishment, because food is more than just chemistry. It is taste, it's sensuality, it's smell, it's all of the aspects of chewing and digesting, the rhythms of who we are. So that's quite diverse. And so I think one of the essential parts of this work is understanding the particularly unique needs of each individual, that there's not one size that fits all.
And that's one of your big principles in, you have all these different principles in terms of diet and I for mental health. And one of the things I wanted to do was just sort of talk about these because they're very and one of them is very much the the sort of bio individuality and the fact that one size does not fit all. So in terms of your healing mental health methods using the nutrition and your book, Nutrition for Mental Health, you talk about these 11 factors that are need to be taken into account for mental health, for better mental health. Do you mind if I just read these and then you can elaborate on each one? Would that be helpful, I think? And one of them
Please.
is about the bioindividuality. And I like that. But the first one is, eat breakfast. And you talk about eliminating carbs, combining with protein and fats. Can you tell us more about why that one?
Sure. Most people are going to do well after a night of fasting, waking up and eating something substantive. The brain benefits from carbs, fats, and protein. However, oftentimes in our modern culture, children and adults are either skipping breakfast or perhaps are eating refined carbohydrates or lots of sugar in their diet, cereals or low fat yogurts, which are a lot of sugar. Um, Sweets, for example, pastries. And what happens is that the uptake of sugar in the body becomes so rapid that it alters mood. And it's one of the major factors contributing to mood lability in children and adults. And that's why when I'm working with someone who's got mood lability, that often is misdiagnosed as oppositional defiant disorder or bipolar disorder, I want to stabilize mood biochemically with lots of fats and protein, which are really the anchors of mood, which are slowly used by the brain and the body and really stabilize our mood and our cognitive function. And so one of the first and easiest things to do, I say easy, it's a sugar addiction is not easy, and it's perhaps the most important ignored addiction that we have in industrialized societies that's now spreading throughout many traditional societies as well, is really drawing on the principle of eliminating the toxins and replacing with the nourishment. And that's not to say that we need to ignore our sweet tooth. We need sweetness in our lives. We need sweetness, especially after the bitterness that trauma brings. But nature has given us many sweet foods and herbs that we can use. So I call it the principle of substitutions, where we're not eliminating sweetness, but we're eliminating the poisons of sweetness of modern society.
Yeah, which makes total sense. And the other one is nourish both your brains, your second brain and your first brain. Can you tell us a little bit about that? Because we know so much about the gut brain connection. And so, how do you address that? That's your number two.
Thankfully, we are learning more about the gut brain connection, the first brain and the second brain, Dr. Gershon's very lovely name for our gut, the second brain of our gut function. Well, we know that most of our neurotransmitters are actually made in our gut. So, where there are gut problems, which are very, very common with the experience of PTSD and complex trauma, then we're not making these nourishing chemicals that are going to support brain function, cognitive function, mood, balancing, focusing, and learning. And I say this to all of my clients and my students that I promise you that where there is mental distress, mental illness, there is always gut distress. There is always gut dysfunction or digestive dysfunction. It could be in the esophagus and the stomach, what we call GERD or acid reflux. It could be an ulcer. It could be GERD or SIBO. It could be colitis or inflammatory bowel disease. It could be chronic diarrhea or constipation or hemorrhoids. Anywhere along the track of digestion that's part of the gut brain axis, there's going to be disruption. First and second brain work bidirectionally together. And so, yes, we're working on healing the brain in trauma, but we must also heal the second brain. And the only way to do that is by restoring gut function through healthy nutrition.
And when you say healthy nutrition, like what are the key things? And I mean, I'm going to sort of go from a bird's eye view to detail, but we'll go back to the bird's eye view. What are the details of, the best nutrition for your gut?
Again, I'd return to the concept of what we're taking in that's damaging the gut and what we're doing that will heal the gut. And it really depends where the blockage or the problem is, the inflammatory process. But I think a major principle about healing the gut is looking to what nature provides. Has nature created this food for us? Nature gave us sugar cane, which is absolutely fine to eat. It never caused mood lability to chew on sugar cane. It didn't cause diabetes type 2. So I'd rather look to sugar cane. I'd rather look to the fruits and the fibers and the prebiotics that are part of traditional diets. So I think a basic principle of healing the gut that can guide us is, did nature give us this, or did nature give us this package filled with excitotoxins or also chemicals that are in packaged foods that have hydrogenated oils that damage arterial function in the heart and the brain. So that's a broad-based principle that we can explore. And then we look at some of the basics of nature. Nature's given us a range of proteins, both plant and animal. And we can, depending upon what nourishes our particular biochemistry, draw on those proteins because those proteins are rich in amino acids. And those amino acids are the precursors to our brain neurotransmitter function. And we know in trauma, because of the inflammatory process that occurs both through the traumatic experience itself, but also through poor nutrition and challenges to self-care, we're going to have a depressed immune system, which affects brain neurotransmitters as well and raises the inflammatory process. So nature's given us fibers to cleanse the walls of the gut. Nature gives us probiotics. If we look at every tradition of the world, every culture, and you'll pardon the pun here, every culture has cultured food. Even in Great Britain, our culinary capital of the world, we have wonderful sides of beef that are left hanging on porches to develop a delicious green slimy fermentation. And so I encourage people to look at indigenous traditions to understand the prebiotics, the fibers, the probiotics in fermented foods, and then to understand what nature's given us to heal the gut and soothe the gut, and therefore be able to uptake the nutrients. Because one of the things that happens when we've got an inflammation in the gut, particularly in the small intestine, or it could be the large intestine, is that we get what's called intestinal permeability. And that allows toxins or larger proteins into the bloodstream that circulate, that contribute to allergies, autoimmune function. The most notable of which, let's say, is gluten and casein, the proteins of both wheat and dairy. And if I may say one more thing, I love the research that was done. One of the things that we know about the effects of gluten on gut health, and many people are sensitive to gluten, was done in your country itself during World War II. One of the things that was discovered is because of the wheat shortage during World War II, the inability to deliver bread to people who were housed in the so-called at the time asylum, mental health asylum. And what they discovered is that many people improved in their mental health. And it was one of the stages of discovery that gluten was a culprit in psychotic disorders and in chronic depression. And so very practically, what I do is I test people for this. I test for gluten sensitivity because gluten can inflame the gut wall and thereby cause a whole host of sequelae associated with that, most notably depression, but also chronic pain.
So interesting. I mean, I read that and I thought that was fascinating. Your third premise is eat only when relaxed. Digestion only occurs when the autonomic nervous system is on and as the digestive juices flow. I mean, that sort of links to the whole discussion about stress and the nervous system dysregulation, which you're so eloquent about in your book. And so it's a much larger point, I think, than just digestion. But, you know, the dysregulation of the nervous system is so key in not just digestion, but other elements of physiological balance and health.
Well, rest and digest. And I think here again, we look to traditional practices to guide us. What has nature helped us evolve in our different cultures? And if you think about our traditional rituals of getting together with a group, our family or our extended family, maybe we've already gathered food together, we've prepared food together, we might be singing or breathing together while we're gathering. We may hold hands in, say, grace in a particular spiritual practice, or we may meditate or pray or give thanks, whatever it is that we do. These are rituals that are designed to keep the outer world and the outer stressors of life at bay and come together as a whole unit to help self-regulate. And this is where you and I were talking earlier about we put so much onus on the individual to heal or the dyad to heal. And yet, healing is a community event. Healing and nourishing and eating should be a community event. And to our detriment in our modern society, many people are eating alone. And so, eating well for our health is so much more about the biochemistry of nourishment. It is about the spirituality of nourishment and how we regulate the nervous system, not only within ourselves, but within the group. And the group helps us regulate. And so many of these rituals can be added in to the healing process. And very practically, I like to teach cooking. I like to gather people together to learn some of these methods that they can then take home or take back to their clinic, take back to their agency. And remember, these are lost memories that we need to gather back together and reenact together.
Completely. Oh, that's beautiful. And then you talk about eliminate exposure to additives, hormones, toxic pesticides, using wild and organic. And, how important is that for mental health? And how do we address that when finance might be an issue, for instance, or access?
Yes, I think addressing food insecurity is an important lens that we need to bring to our work. We need to understand what people can afford and how to afford it, how to access and eat these delicious and healing foods. For example, we can make our own sauerkraut, buying a cabbage for $1. And instead of an expensive farmer's market sauerkraut that we may come across. It's very important that we work with our clients to understand how can I access healthy foods for me. I think indeed many of our cheap foods are filled with lots of sugar and additives and very dangerous chemicals. I mentioned before the term excitotoxins. These are additives that are known to excite the glutamate receptors, which destabilize mood, for which there's significant research, particularly around mood lability in people with a diagnosis of bipolar. But my feeling is we have to tease out all of the factors influencing mental health before we can really understand what truly is going on with someone, because people are so flooded by influences and stressors. And these additives are stressors, hormones. We know that we're seeing earlier puberty all the time because of exposure to these exogenous hormones. And that's to say nothing of the disruption of liver function or the development of endometriosis, or PCOS, which is highly correlated with PTSD and complex trauma. So we want to try to tease out all of these extraneous influences of often modern life that are hampering the capacity, what I know is the innate capacity of the body, mind, and spirit to return to balance that's been disrupted by the traumatic event.
And I think that's so beautiful. And before finishing, continuing with that list, I just wanted to quote a couple of things from your book, which I thought were really beautiful. Because you talk a lot about sort of, the link between emotional trauma and the physiology. And, one of the things that you said, which was very beautiful, the natural rhythms that pulsate, oscillate, and vibrate in humans and animals drive our sense of balance. This book, so the Rhythms of Recovery book, focuses on how these biological rhythms are affected by trauma and how a holistic approach may restore them. And you also talk about how the ancients of many cultures considered gaining control over their autonomic nervous system and hence over the mind integral to health. And so there is this sense that really, and you say also in health, these organs function rhythmically without conscious control, giving rise to the ebb and flow of life. And this is all very beautiful. So essentially what you're saying is that, in nature, we know exactly what to do. But the problem is we're dysregulated by trauma, whether they're psychological experiences or whether they're biochemical assaults such as toxins and pathogens. And it's all about reestablishing homeostasis and balance. But also, I love this idea of gaining control over one's autonomic nervous system and hence over one's mind. Can you talk a little bit about that? Because I thought that was really very important.
Many of our practices are around regaining control over our nervous system. I was fortunate to study Chinese Taoism as a teenager, and that set me on a path of understanding this ebb and flow, and the mood lability that I experienced and was attempting to gain control over. And I think if we look all throughout the cultures of the world and these various practices, we're given tools to achieve this. One of the things that I love to do when I'm working with someone who is experiencing this disruption of the flow, and literally it's a flow of digestion. If we segue from nutrition and what we put into our mouths, not everybody is always ready to make those changes. Self-care, particularly at the early stage of recovery, is very challenging. And I think related to this sense of gaining control over our autonomic nervous system, that's a heavy load to bear in the early stages where we're really seeking safety, stability, and comfort. It's often when meditation does not work as well as, let's say, vigorous exercise. But one of the things I love to do as a body worker is invite my client to lie on the table and very gently palpate the organs of digestion. After all, you mentioned in that quote the rhythms of digestion, the peristalsis, the undulating Ouroboros of moving waste and digesting it and uptaking it, but then eliminating it. And our disruption of those rhythms stops it in its track or loosens it so completely that the flow is overwhelming. And I think that's a physiological response to the intense ups and downs, the overstimulation and the numbing that we experience in trauma. And so the idea of helping someone, because after all, we can't always help ourselves in those early stages. We need that conduit, that channel, that connection that we're going to exchange that relaxed nervous system function of the therapist and help someone discover that in themselves through a gentle massage, through getting up underneath the diaphragm and releasing that tension of gently soothing where there's pain, where there's tension, and helping someone learn to breathe, open up their breath as they feel and come back into their body, because after all, they're often outside their body in these early stages. And I think that's a very real connection of healing that occurs that often needs to happen before nutritional change, or it might be called for after nutritional change. And after all, many people have been traumatized by touch. And so the application of that particular method may be done at a stage of healing where deconditioning the pain of abusive touch is called for.
Yeah, that makes sense. And I mean, this brings me to that sort of intersection between trauma and the biochemistry. And, you go into great detail in your book about the impact biochemically of trauma on the body, whether it's, inflammation, mitochondria, detoxification, gut health, brain development, metabolic function, neurotransmitters, and hormones. And even circadian rhythms and balance and natural rhythm. So can you talk to us a little bit like how trauma does this, sort of in a nutshell? I mean, it seems that, childhood trauma or chronic stress is so pernicious when it comes to both our physical but also our mental health. And so there's sort of this sense that, you can't get better unless you address the trauma, but also you have to address the biochemical effects of the trauma on the body. So as a practitioner, first of all, how do you go about this? And also, how do you explain sort of technically the impact of trauma on the biochemistry?
Wow. Well, let me take that in very tiny pieces as best I can, and maybe point out a few things. We certainly understand that trauma in its overwhelming effect disrupts the hypothalamic pituitary adrenal axis. And we know through extensive research that began a number of years ago looking at Holocaust survivors and later complex trauma survivors. And we actually did this with a research study that NIH funded us to do with native dementia caregivers who also had experienced extensive trauma, looking at cortisol levels. Cortisol levels while they're labile, we test those through saliva, and you get a very good snapshot of cortisol, or our stress hormone that we need to deal with stress, but also called the death hormone because too much of it will burn our brain neurons. And so, understanding the effects of chronic stress on the body is like I use the image, and I use a lot of images with my clients because they don't often care about chemistry, but I use metaphors. It's like having your foot on the pedal of your car and accelerating it, and you're in park and you're burning out the engine that way. So, under stress, your cortisol rises. And then over time, you run out of gas. You're depleted. And this is what we see so much in people who've been chronically stressed, who have not had the nourishment of all types to restore that engine, as it were. And so the groundbreaking research was looking at Holocaust survivors and their survivors as well, their offspring, and looking at this chronic depletion of cortisol in the body, particularly upon awakening. And the clinical signs of that are lethargy, exhaustion, the need to self-medicate. And here we come back to nutrition. These individuals tend to self-medicate with too much coffee, too much sugar, too much refined carbs for that quick energy. And it's an unconscious gravitation toward those foods. And so much of what we do is an unconscious kind of self-medication. And so my thinking is, let's make it conscious. Let's self-medicate. Let's give ourselves what we need, but let's understand why we're doing what we're doing. The other thing that's a piece of all of your question is how medications help or don't help the disrupted biochemistry. And as you know from my work, I am not as much interested in the role of medication. I think by and large, they're not useful. I think the research is quite limited on their efficacy. And I think they bring a great deal of side effects and disruption as a layer on top of the already dysfunctioning biochemistry. Let's take mitochondria, for example. We know through research that the SSRIs and the SNRIs and the antipsychotics, which are used off-label, oftentimes for sleep disruption in complex trauma and PTSD, suppress mitochondrial respiration. We need our mitochondria for our energy. We see so much energy depletion that co-occurs with Epstein-Barr virus, certainly with COVID and long COVID. We see it in chronic fibromyalgia. These are all co-occurring physical manifestations of chronic stress response in the body in which the mitochondria are not functioning well. And the study of mitochondria and its effects, their effects on mental health, go way back. This is not a new theory, but it was kind of tossed aside for many years as we came in and decided to bang on the brain with the SSRIs and say, get in shape, let's increase that serotonin response or that dopamine response. So I think we're returning to understanding that we need to nourish the mitochondria. And one of the ways we do that is through certain nutrients, certainly through foods, through exercise, but through a nutrient, for example, CoQ10. And added to that, and I think what I'm trying to convey is the layering of stress on the body. Many people with disrupted nutrition have disrupted cholesterol levels, and we've got an epidemic of statin use. Not so much an epidemic of cholesterol imbalance, but we've got an epidemic of statins. And there is no greater detrimental effect on mitochondria than statins. And so I think it's very important as we're working with understanding how trauma affects the body, how we're then restoring and treating the body and not just adding on one medication that we then need to use another medication for. So that's just a little bit about the stress response, mitochondrial response. We have immune responses as well that lead to chronic low inflammatory process that lead to chronic pain conditions. And we often don't have, in conventional approaches, a very adequate approach to managing pain. But I think nature has given us a number of options, and some of our natural methods, acupuncture, body work, but even things like photobiomodulation, cranial electrical stimulation. I think the idea is that we put together a synthetic approach, meaning not a fake approach, but a synthesizing approach in which a little bit of a variety of things help the body and the individual come back into the balance that there's to begin with.
And so when you talk about mitochondria and inflammation, I mean, so you talk a lot about sort of the cortisol and the stress response and the dysregulation of the HPA axis through trauma, but does inflammation, you've also talked about how trauma increases inflammation and chronic inflammation. What's the mechanism behind that? And also, what's the mechanism behind mitochondrial dysfunction and its link with trauma? How does that actually work?
Very briefly, the inflammatory process, just think about when you stub your toe. You stub your toe, you go, ow, and then the body rushes in. The immune system is on call and says, I'm going to come help this. It floods it with fluids and immune cells to heal. We swell up. It's hot, it hurts, and then over time it recedes. Think about trauma as constantly stubbing that toe systemically. And it may hurt to varying degrees, but oftentimes it's at a subclinical level where it's like a slow burning fire in the body. And then we experience pain and we take a leave or an NSAID every day. We don't get at the root cause of that stubbed toe. We take something to suppress the natural healing response that's now really gone out of whack. And note that's a clinical term. And the NSAID has negative effects on liver function, has negative effects on the gut. It may decrease our ability to absorb vitamin B12, which we need for cognitive function. Chronic use of NSAIDs is going to impact our liver, which we need, our liver and gallbladder, to emulsify and break down our essential fatty acids, which are necessary to fight inflammation in the body if we're lucky enough to be able to afford to eat fish or afford to eat fish oil capsules. And so you have really a cascading effect in all directions. I think about a center in which there are rays moving out and inputs coming in, affecting all aspects of this biological and physiological function. So I think that's just a little bit of how we approach it clinically. I think for me, I'm fascinated by the science and the biochemistry, but each individual comes at a certain stage of health or illness. You mentioned, for example, circadian rhythm. One of the things that we know is so beneficial to reset circadian rhythm. And remember, the hormonal response of cortisol follows circadian rhythm. So we understand when we test that salivary cortisol, if it's low in the morning, we can see. As a matter of fact, if I see a client's cortisol low before I even meet them, I know they're depressed. It's a biological measure of depression. I know they're fatigued. I know they're probably self-medicating if they're working and trying to have some get up and go. And the correlate to that very low cortisol in the morning is often a very elevated cortisol at night, which contributes to insomnia. So then they may be taking an Ambien. And we know particularly women have very adverse responses to Ambien that lead to problems functioning the next day because we metabolize it much more slowly than do men. So I want to pick an organ system when I'm working with someone based on what their complaint is. I think we go back to our conventional psychotherapeutic model is what's your complaint? What's bothering you the most? What's your priority? And let me help you figure out the most effective changes that you can make step by step to reestablish the rhythm. And in trauma, we carry so much shame about our dysfunction that I feel like there's an element of this that diminishes the shame when we explain this to our clients, when we reinforce that what's happened to them certainly is not their fault, but beyond that, that their body is telling them their story, certainly, and that as we listen to their symptoms, we listen to their gut symptoms, their liver dysfunction symptoms, their headaches, the body is telling us you're gluten sensitive. You need more omega-3 fatty acids. If you live in Great Britain, you're low in vitamin D, or if you live above the 38th parallel, let's bring it up to optimal levels. Let's begin with some of the basics. Let's integrate some fiber. Let's help you digest better with some digestive enzymes. And I'll walk with you step by step along this path to restoring your sense of well-being.
It's really wonderful. And in terms of your work, I mean, one of the things that I notice is that a lot of people are either working with trauma or they're either working with nutrition. And would you say that it's absolutely crucial to do both? And how do you approach it? When someone comes into your office, how do you know which part to start? Do you address it all at the same time? Do you test your clients and do lots of labs on their nutritional status? What do you prioritize in terms of, somatic work for their trauma or psychotherapeutic work for their trauma versus the sort of biochemical, this is your nutritional status and this is what we need to improve? How do you deal with that sort of split world, essentially?
I think it's important for people doing psychotherapy and doing trauma work to understand nutrition, to make appropriate referrals. Likewise, it's important for people using nutrition to understand the role of trauma in affecting why people may or may not be adherent to a program, and understanding that it's not that you have just a client who doesn't want to do what you're telling them. They have challenges with self-care that we need to help people overcome, or how prevalent are the eating disorders, highly correlated with a history of child sexual abuse, and understanding that self-nourishment and self-care is both an emotional issue, but it's also a physiological issue and a biological issue. So it's not that I would expect that each discipline become expert in the other disciplines, but I believe in speaking each other's language, that at least we know enough to make appropriate referrals and to collaborate and to create that beautiful container and holding environment of a whole team nourishing that client and walking with her or him or them along that path where there are going to be ups and downs. And so I think what you're asking about also is the art of the work. And that's what I do in my postgraduate clinical case courses where I'm working with established clinicians who are in their own right practicing, but are now integrating how do I test and what do I test first? How do I interpret this test? For example, I think some of our basic tests give us a lot of insight. And let's also recognize the value of tests. It's not always that we need to test, but oftentimes a client benefits from seeing the results on paper. I can look at a client and say, I think you have PTSD based on our clinical intake, but I might decide to do an assessment or a CES or an assessment for dissociation as a way to reinforce that. And I think our use of clinical tests has an added value for supporting the client in their choices. I think some of our basic tests are taking an omega-3 fatty acid test to understand how much omega-3 are circulating in your blood, and therefore, can you benefit from additional intake of fatty fish? I'll always do a vitamin D level. I want to look at A1C, which is our average of blood glucose over a 3-month period, to understand how the body is handling sugar. And if that's going to be a priority, all of these things are going to work together, just like we're going to go shopping and buy lots of fruits and vegetables and proteins and put it on the counter. And then we sort them out and say, what am I going to make tonight? What dish and how am I going to put this together? And that's the dance between the clinician and the client, because I'll give you an example. I use this example in my book. I had a wonderful client named Joan who was eating and drinking just way too much coffee and artificial sweetener and fake milk products, and her gut hurt her all the time and she was depressed. And I just began working with her, and she lived alone. She wasn't going to start cooking elaborate meals. I said, Joan, how about if we change out the fake sugar that you're using, that artificial sweetener, which is disrupting your mood? Let's get out that fake powdered creamer. How about a little raw honey? It's going to be good for your gut. And how about a little real whole organic cream, which is going to nourish your brain and satisfy you and hold that energy longer. And it's going to decrease your craving for that mid-morning sugar. Well, she loved that idea. There was nothing that was asking her to be a monk and live in the Himalayas chewing on roots. This was something that was going to nourish her spirit, her taste buds, and her first and second brain. And so I think we call upon our clinical skill to get a sense of what the client can bear, what the first steps are. And I use motivational interviewing to understand that. I think we can become more complex in our testing as well. I'll test gut function. Do we have an excess of bad bacteria that's going to drive some of our choices around integrating more use of garlic and the sulfur foods, the natural antibiotics, the onions and the artichokes? And that may include also what kinds of herbs are we going to use to help balance out circadian rhythm. For example, licorice root is one of our preeminent balancers of the HPA axis, and it's used in Chinese medicine, in Ayurveda, in American Indian medicine also to support that. And not coincidentally, it's very soothing to the gut. It's a natural treatment for GERD and acid reflux. It's also a natural estrogenic precursor. And you mentioned hormones. hormones are absolutely essential for recovery. We see a disruption of hormone function. It's why we see so much PMS in trauma survivors, this PMDD, a more recent diagnostic category, PCOS, polycystic ovarian syndrome, associated with excess use of refined foods as well. We see challenges to fertility among trauma survivors. And then by the time people hit middle age, progesterone lowers much sooner than it should in the early 30s rather than the early 40s, leading to challenges for sleep, challenges to anxiety, because after all, progesterone is our anti-anxiety, pro-sleep hormone. In men, we see andropause, where low testosterone is even exacerbated earlier than it should be, leading to chronic pain, leading to sleep problems and gut problems. And then we have the added challenges of these synthetic hormones and these patches that create Parkinsonian type symptoms. So I always encourage my clients when I'm referring for bioidentical hormones to go with nature and restore what nature has provided. The loss of estrogen, as estrogen plummets during perimenopause, so do our neurotransmitters, leading to an exacerbation of mood where there's already perhaps a challenge to balancing mood. So I think these are all the elements of the Rainbow Blueprint, where we look at what do you need to get the biggest change right off the bat, what's going to be easiest to implement, where can we get change to instill hope, because so many people come to us with a loss of hope. How do we instill that hope for recovery?
I think that's really, I mean, I keep thinking your patients are very lucky, Leslie, to have you. But I think, one of my questions also is, as a practitioner, do if somebody's diet is absolutely terrible and they have trauma and they've come to you to do sort of somatic work and therapy, and they're not really interested in changing their diet, or maybe they have an eating disorder, or maybe they're a teenager who is just not interested in eating anything but sugar and junk food. How do you tackle that? Because the two are so interconnected. And I think following on from that is, there are a lot of therapists who don't talk about nutrition at all. And, if you're not going to address the nutritional piece, how do you get people better? And can you really help people to recover without that nutritional piece?
I think all of this work really comes down to awareness and increasing our awareness of our lives, of ourselves, how we function, of how we're communicating within ourselves. And whether it's psychotherapy, bringing awareness, whether it is our therapies, our somatic therapies that bring awareness of the connection between our body distress and our experiences, our memories, that are dissociated and living in other parts of ourselves, bringing that together. And I think nutrition is quite analogous to that. As a psychotherapist, I would sit for many years sometimes with people who came to me talking about their problems, working on their addictions, and I would hold in my heart for them that they had histories of trauma, that they were telling me about the trauma, but it was walled off. And my job is to be with them up until the point that they can open up that door and let that memory, let that awareness come in and continue to build that fuller sense of self. And I think nutrition is like that too. Someone might come to me with digestive pain and say, I don't want to change my diet. And I'll go, great. Then how about if you get on the table and let's try to release that digestive pain? And then we might do a food mood diary. And I say, what's interesting about these 3 days is you report pain after you drank milk this day, but you didn't have pain the day you didn't drink milk. What do you make of that? So I think we're looking ultimately at awareness of connection and of restoring those disparate parts of ourselves. And I think the word is patience. We have to have patience. And I think ultimately we have to do the work ourselves. We have to have the body work. We have to get off Diet Coke. We have to be on this journey ourselves so that we can guide another and have the compassion that change is slow. We know from our own healing that we heal very slowly, but I think with compassionate guides along the way, that healing is assured. Now, that's not to say that we ever completely are restored to some optimal sense of self. I think that's a fallacy. I think there are some traumas that are so great. You never grow a leg back that you've lost in war. You may adapt, you've got a prosthesis, you may have pain. There are limitations. And I think that's what we're pushing on is how far can we go to restore our whole self while recognizing the scars and the pain that we'll always carry.
Yeah, and that's very true and very beautiful. And conversely, if somebody is really not interested in working on their trauma, or maybe they feel that they don't have any trauma and they've had, a perfect childhood, and if that exists, but their diet is terrible and they eat a lot of processed foods and they're sort of stressed. Would you say that you can help somebody completely recover just by addressing their diet without addressing the psychological impact? And also, do you think that people's dietary choices are influenced at all by trauma? So would you say that people who have been traumatized are more predisposed to a poor diet?
Okay, those are two questions, and remind me if I forget one.
Sorry, I have a
I've
tendency to
already
just
forgotten your first question.
just deal with the second one.
Your first one was a good question, but it flew by. um,
Well, the first question was basically, if somebody says that they have no trauma and they have
oh,
no psychological they've had the
you know,
perfect childhood. Yeah.
I've met a few people with a perfect childhood in my career. It's astounding, but they do exist. um, there are some people who are just fine keeping the lid on. I don't think we need to pull that lid off Pandora's box for everyone. I think some people do much better being tightly wound. Now, the converse is also true. Um, what I've noticed is that some of us make the change when we hit the wall. And what you're describing is at some point in life, some people hit the wall. And it could be, oftentimes we see it in midlife because the accrual of these stressors, oftentimes people are quite resilient up until the bottom falls out of hormonal function at midlife. And that's when we often see this explosion of autoimmune dysfunction, fibromyalgia diagnosis, massive anxiety and insomnia that bring people into treatment. I love the stories that we read about the cardiologist who had a heart attack and totally changed her way of treating people because now she understood what it meant and how she perhaps wasn't as heartful in her treatment, or the GI doc who discovered probiotics and prebiotics instead of these intense pain medications that were just masking symptoms. So I think again, we have these choices when we hit these nodal moments in life where we can't go further, where the medications are not working any longer. So that's who comes to me. They're already coming to me ready for that change. They've tried everything. They've done all of the therapy and they've made good progress, but there's still the missing piece. Now, to your second question, I do think people can make a lot of improvement by just improving their nutrition, just by exercising. We know the research shows that if you got an hour of aerobics every day, you probably wouldn't need a psychotherapist. And so I think this is the nature of what we have in our repertoire, that there's enough out there that we can fit to the individual. I love working with children who are not going to change their diet, who have focus and attentional issues, and who, the parents are fighting perhaps. But we begin with the martial arts. The martial arts are a wonderful way to focus concentration within, develop discipline, but also work within a group setting. And fencing is another movement activity that I do with children with these issues. Yes, I'd rather them have bacon and eggs in the morning than cereal and milk. And I'll work with the parents to change out the bovine milk to, let's say, a hemp milk. We might hide some nutrients in a delicious chocolate, even with a little bit of coffee smoothie for those children, in order to keep them off the amphetamines, for example. So we work with the individual at their age and at their stage to help them. And I promise you that as we move along this path, our awareness, our connection increases. I'll tell you one quick story of a wonderful case I just heard from this former client recently who was an example of what you're describing. She said, I need to change my diet, but I'm not getting off any of my 7 medications. I said, that's fine. And in the back of my mind, I was thinking, these 7 medications are not helping you, but let's begin with what you want to do. Now, we worked together for 3 years, quite focused on changing her diet, getting more exercise, and step by step, she said, I don't think I need this medication. I don't think I need that medication. And over 18 months, she came off all her medication. She's very severe trauma survivor, sleeping well, eating well, exercising, living
And
her life to the fullest.
and that you feel was really a combination of your work with trauma and your therapy and your somatic work as well as the nutrition. Yeah.
Absolutely. All of
Yeah.
those are essential. So the question I think we ask as clinicians is what's missing? And because most of us are trained in one tradition, let's say psychotherapy, we often don't incorporate. We are more incorporating the somatic, whether it's the touch or the non-touch somatic, and and that's an essential piece. That's where my work began. But I began to understand that we needed to nourish that engine. We can have a wonderful car, but we need to put in the right gasoline and the right octane. And some of us drive VWs, some of us drive Jaguars, and we need to know what we're driving. And that's where the clinical analysis and assessment and testing comes in, so we can fine tune what kind of car are you driving and what's going to give you the most efficient movement of that engine to support your neurotransmitters, help your gut, drive those mitochondria.
That makes total sense. And in terms of, you mentioned ADHD, you mentioned depression, anxiety, focus, and you talk a lot about these in your books. But could you give me sort of the key nutrients, your top 5 nutrients for mental health? And maybe there's some variation according to the disorder. Maybe it's slightly different for ADHD as for anxiety, as for depression. So, but maybe it's not, maybe it's the same. So if you could just give us a sort of sense of your, without being too prescriptive, but I'd just be curious because I know you have your favorites.
I do have my favorites. I've mentioned vitamin D, which is actually a neurohormone. We know that vitamin D is very important for depression, chronic pain, and immune function. It's involved in cholesterol metabolism, which is very important for the brain. The brain is 60% fat, mostly DHA. And so that leads us to the omega-3 fatty acids. We didn't see ADHD and depression among Northwest Pacific tribal peoples prior to the change in diet. We didn't see depression and suicidality among peoples of the Arctic who were eating plenty of omega-3 fatty acids prior to colonization and the introduction of refined sugars, wheat, pigs, cows, none of which were in the Western Hemisphere. So this link between what we need nutritionally is, as a matter of fact, I don't want to wax too esoteric, but what we know is that people who evolved along these coastal regions and had plentiful omega-3 fatty acids. So you're looking at people of Japan, of Ireland, off of your coast, the Pacific Northwest, the Arctic Circle, actually lost the use of the delta desaturase enzyme, which helps break down and metabolize fats in the body, and also has an effect on sugar because they had so much fat, they didn't need this enzyme to do anything about it. Now, what we're faced in modern time is the lack of that enzyme and a diet that no longer provides these omega-3 fatty acids, but instead is sugar rich, refined carbohydrate rich. And we see elevated rates of diabetes type 3. Excuse me.
That's so interesting. And I mean, I think also the ratio, right, between omega-3 and omega-6 is so important, and our processed foods are so full of omega-6s, and it's totally tipped the balance.
That's right. And another often neglected fatty acid is gamma linoleic acid, GLA, which occurs in borage oil, blackcurrant seed oil. Very important for depression, for skin health. And we know that there's often skin problems, dermatitis, all kinds of psoriasis in highly associated with traumatic events. And so these oils are very nourishing to the skin. So our B vitamins are really supportive of our neurological function. And here's where we get into fine tuning the B vitamins. Some people, because of their genomic differences, have a greater need for folate, B9, and some less so. Some people have a greater need for vitamin D because of their genomics.
Yes.
And so when I'm working with someone, we'll certainly test vitamin D, but we might test the genes to say, oh, well, this is why you can't get your vitamin D levels up on 2,000 units a day. We need to go up to 10,000 units a day. And so we're always personalizing and fine tuning based on lots of information that's coming in. We can do testing on nutritional status, toxin levels. Many people with trauma, we think a lot about interpersonal trauma, but many people have environmental trauma. They've got exposure at war. I've worked with many Vietnam vets, Gulf War vets, whose mitochondria have been affected, who carry heavy metals in the body. And there's a whole element of our work that works to detoxify, that supports liver function, that brings in herbs, that optimizes the ability of the organs to eliminate waste, and nutrients can help with that as well. So we begin with some of these basics. I call them nutrients that really almost everyone can benefit from: the omega-3 fatty acids, the vitamin D, the B vitamins, I think are among some of our best.
And the minerals?
And oh, excuse me.
No, I was just going to say, so so those are the vitamins. What about the minerals? Because I know you talk about those in your book, and some of them are crucial for mental health.
Minerals are spark plugs for our energy. And what I'd like to begin with everyone is a very nice, high quality, natural vitamin and mineral product that they'll benefit from. One of the favorite minerals is magnesium. It's the most abundant, and there are several types of magnesium, and depending upon the effect that you want, you choose that particular type of magnesium. Magnesium relaxes the musculature, which is often tight as a result of trauma. It helps us sleep. And there's one type of magnesium that was synthesized at MIT that crosses the blood-brain barrier that helps us sleep and helps us relax, called magnesium threonate. And so magnesium citrate will loosen the bowels a little bit. So you might take, if you're constipated, that might be a natural laxative that you take in very small doses until you balance out what's going on with your gut. But then you might take magnesium threonate. Chromium is another important mineral that's used to decrease carbohydrate cravings. And you asked about what people who've been traumatized tend to drive towards in terms of their food. They don't tend to crave carrots and celery. They tend to crave refined foods. And that's because of their effects on the brain. Sugar releases dopamine. It gives you a good feel-good feeling. Refined carbohydrates increase your serotonin. And so it's a self-medication, but it's an unconscious self-medication. So chromium is something that I use to help decrease those carb cravings, decrease the sugar cravings, and then we up protein and fat in the diet, because protein and fat, sugar cravings are often a sign of low protein. And this is where a vegetarian diet that's not biologically aligned with the person's biology can really increase carb cravings. And we see a lot of sugar addiction in vegetarian diets. So not everyone's meant to be a vegetarian.
Yeah, no, I agree with that. But it's interesting what you say about the effect of trauma on your cravings for, and I'm wondering the mechanism of that, I guess, is that sort of low-grade inflammation interferes with your neurotransmitter production. Is that why people who have sort of PTSD crave these sugary and refined carbohydrates, because they're looking for the boost in dopamine and serotonin, which they're not getting due to chronic inflammation and low production of neurotransmitters? Is that the mechanism?
I think that's one of them. I think people tend to eat lots of protein for focus and for energy. We tend to crave the carbs and the sugar when we need to relax more. It's not an anomalous response. We might get an initial boost of energy and then relaxation, but it doesn't last, and then it leads to deleterious effects. But there's also cravings that I identified that are not just around self-medicating biochemistry. We crave foods that remind us of a time of our life. Could be positive or it could be negative. We may crave foods um, uh, that we ate or that we are allergic to. Oftentimes we crave gluten when in fact we're allergic to it. We might crave,
Why is that? Yeah.
I'm not sure of what the mechanism is for that. Um, but we know that it's why, for example, Overeaters Anonymous asks people to just go cold turkey on breads and glutens. And what we find in practice is that if you can cold turkey your sugar and your refined flours and your gluten for 1 week and replace all of those foods with good quality proteins, little bit of vegetable. Like I like to encourage people to eat the root vegetables, which are very nourishing and they have a natural sweetness. Um, and then you have plenty of good quality fats. The physiological craving for those sugars and the carbs are gone. You may still have an emotional craving that takes some time to work on, but the actual craving is gone. And I see this over and over again in practice, and people will routinely come in and say, I feel much more stable emotionally.
Mm.
And then we get to tease out, well, how much of it is what you're eating? Is it 50% of your mood lability and in your teen or whomever it is that due to this bottomless pit? You're never satisfied eating those pizzas at night or those breads at night, and you actually wake up drugged the next day
Yeah.
because those foods, and part of the mechanism is that it releases opiates in the brain,
Yes.
and for some people more than others. And we can test that also. We can do an expensive test, but we can at least identify that. And that brings us back to this issue of food accessibility, because you know from my work, I'm very involved in social justice work and access and food insecurity, and that all of this work needs to be made accessible. We've got wonderful organization, integrative medicine for the underserved, and I think all of us have to give back to the community. We have to do service. Indeed, the word therapy comes from the Greek word therapeutikos, meaning to serve. So I think all of us, I believe, need to have an element of service of what we do. And so I think that accessing food and making it available, one of the ways I do this, I say, well, let's avoid this $500 test. It's not necessary. Let's just do an elimination of gluten for 3 months, because that will give you your answer. Do you feel better? Is your mood better? Do your joints not ache as much? Take your pick. We can test your gut, or we can add in more fermented foods. And so I think we can give these options to clients, some of whom have more money, some of whom have more time, and work and adapt to what people need. I think we've got a variety of pathways to walk with our clients.
Agreed. And then you've been very generous with your time. I think we've gone way over, but I just have a couple of other quick questions. One of them was on nutritional lithium, which you talk about, and sort of the hot springs and how helpful that is. And then the other one was on psychedelics, because I know you've worked a lot with psychedelics, and how does that fit into your program? So I guess first is lithium and then the psychedelics.
My favorite topic. Let's take lithium first. Lithium is a natural mineral that the earth gives us, which we've known for quite a millennia, balances out the mood. Now, we know in conventional psychiatry, lithium is used for bipolar. It's lithium carbonate has its deleterious effects on the kidneys, however, so it's a balancing act. But it's hypothesized that lithium works because it balances out circadian rhythm, which is essentially, bipolar is a circadian rhythm disorder. And so if we can aid circadian rhythm through these variety of means that I suggest using the Brainbow Blueprint, then we can help restore a great deal of balance to the brain and the mind in bipolar. Nature's given us the pathway to balancing. If we look at lithium mineral rich hot springs in the southeast of the United States, in Texas, where these communities have no road rage and no domestic violence. I've sat in mineral springs up in Mount Ohanapakash called Laughing Springs by native Tayetnapam indigenous peoples who've long gone there for healing during grief or depression or pain and trauma as well, to lift the mood, to build that lithium stores again. We drink lithium water. Indeed, we used to have lithia tonics that were created that no longer really exist. I mentioned I've sat in lithium springs in the Pacific Northwest. I've giggled in lithium springs in Mexico as well, where people have long gone. So I think we're back to indigenous communities and rituals and the knowledge, the empirical knowledge of what nature has given us. And I think that's an essential segue into what we call psychedelic medicine. I was very fortunate to come of age in Mexico and become exposed to these gifts of nature. Mexico is the cradle of entheogens, entheogens referring to those substances that allow us to know the god or the goddess within. And we call it traditionally or conventionally psychedelic medicine, based on the research that was done with the discovery of LSD by Dr. Humphrey Osmond, I think, a Brit. And so my experience in Mexico in the early 70s informs my approach with the application of psychedelic medicine today. And we're clearly in a revolution of the use of these medicines. However, I'm very much an adherent of not separating out the medicine from the ritual, that these medicines are about altering our consciousness toward an experience that helps us heal. Most particularly, I think the medicines of Mexico, most psilocybin, certainly cannabis is we'd consider cannabis not a true psychedelic, but let's say it alters consciousness. So it's along a spectrum of altering substances that nature's given us. So we might include cannabis and psilocybin mushroom and peyote. We could throw chocolate in there as well as a substance for altering consciousness. And I think it's very accessible and does that. It increases dopamine and focus in the brain. So we've got a spectrum of the gifts of nature. Nature's given us these gifts, and we've traditionally used these gifts in the context of group ritual. And trauma is an altered state of consciousness. And in many ways, that's the old alchemical adage that we heal with the blood of the wound. We heal altered states that are uncomfortable or distressing with an altered state that is healing. And so I think we bridge an altered state of the irregularity of mood, of the inability to live in the body, to sit still in the skin, the ups and downs and the fear and the terror of trauma, with the exposure to an altered state that helps us see the greater sense of self. I think we are on the hero's journey here. We are cast, whether we ask for it or not, and mostly we don't, onto a path of healing. And these substances give us access to our greater self. And our greater self gives us that sense of hope to carry on the day-to-day business of chop wood, carry water. We have to feed ourselves, nourish ourselves, sleep. So I'm a real proponent of marrying the traditional ritual to the substance. I'm not a big fan of what we're beginning to see is the separation of the chemical. We're seeing this with the use of ketamine, which is not a true psychedelic, it's a dissociative, but we're seeing a lot of ketamine therapy done in a clinic with cars driving outside, or we're seeing psilocybin given with a headset in a clinic setting. Okay, I don't, I think we get our healing where we can, but I would love to really see a recognition of all of this work for the sacred roots where it derives. And I think that then fulfills that other aspect of ourselves, which is the sense that we are connected to a greater whole, even as we are healing our wounds.
That's very, very beautiful. And there are a couple of thoughts that I had. I mean, presumably, when you say the ritual, where does therapy fit into that? Because I think, for me, therapy, so psychedelics without therapy is a whole different thing. So presumably therapy is part of that ritual and very necessary for that healing to occur, would you say?
Absolutely. Therapy is a ritual.
Yeah. Okay,
Uh,
got it.
a ritual, it's rhythmic, it's repetitive. We exchange physiological entrainment with a therapist who cares about us, we care about. It is a ritual.
Yeah.
And I think the theme that we've been talking about, that you've so beautifully illuminated in our discussion, is that it's a limited ritual. It's an essential ritual that we want to expand, that we want to incorporate all of these other aspects into the ritual at the right point in time for our clients, whether we do it or whether we do it as part of a group healing or with other practitioners. And it's for my book, The Rainbow Blueprint, I developed a psychedelic treatment readiness scale that a therapist can use, because so many people are coming to us and saying, well, I think I should try ketamine. I think I should try this. What do you think about that? And I'll say, these are all really worthwhile discussions. Would you go through a discussion with me about that to see, is this the right thing for you? And what medicine is the right thing for you? And in what context? Are you destined to go to South America and work with a shaman doing ayahuasca? Are you going to be better off in London in a beautiful clinic setting doing iboga to come off an opiate addiction? So again, we're bringing the principles we have as therapists, which is, how can I help you? How can I serve you? What's foremost on your mind? How can I protect you from the hypophobia of trauma, the urgency to move into many things that may not be right at that moment in time? So I absolutely agree. Therapeuticos is the essential core of telling the story and making sense of our story. I'm an old psychotherapist, and I believe in telling the story over and over to make sense of it and come to terms with it
Yeah,
and transcend it.
and transcend it. So to wrap up, because that's so beautiful, one of the things that I was thinking when you were talking about these shifts in consciousness and how trauma, in some ways, we try to regulate our consciousness because trauma has shifted our consciousness in many ways, and therefore in some ways we're trying to alter our consciousness, whether it's through sort of drugs or alcohol or healthier means. And what you're saying is that everything that we do, whether it's psychedelics or meditation or healthy nutrition or sort of toxins like alcohol and drugs, is really an attempt to restore that balance of consciousness in some sense. And you talk a lot about it, you're in your book about dissociation and the link between people who've been traumatized and who dissociate, and then sort of paranormal sensitivity and a sort of energetic sensitivity that transcends what we consider sort of the normal plane of consciousness. And I find all that very interesting. And it's not really a question, but I find this whole idea of shifts in consciousness, which are either negative and brought on by trauma, or that you're trying to heal and establish a balance through various different methods or substances, is very interesting.
Let's return to the idea of ritual. And one of the missing pieces for healing today is that in all traditional societies, by the time you reach puberty, you embark on a ritual, a quest, a vision quest, some kind of event that signals you've reached puberty, but also is an inoculant to trauma. It's an inoculant to stress. Traditionally, we know that we need to be prepared for the traumas of life. Um, Unfortunately, we have way too many of them, but nonetheless, the missing piece, I think, in our modern life is this inoculant, this training for self regulation early in life, this exposure to conscious stress. And I think that's where we divide dissociativity that is maladaptive and dissociativity that's chosen and that's under our control. And it's a paradox because one is in control of losing control, whereas the traumatic experience is the loss of control uh, without any self agency. And that is what is so traumatizing and disrupting. But traditional societies have always sent us off into the wilderness to face the challenges, to face the beast, to face the weather, to face the aloneness, to scrabble for something to eat, to cross raging rivers, and to test that metal and to raise that cortisol, to be dissociated but gain control, to achieve what was expected. And that inoculating experience we carry then into the future so that when we do face the challenges and the traumas, we have a little bit more capacity to regulate that exposure. And I think that's the piece around dissociativity that I want to work with people on, which is, first of all, recognizing where dissociativity comes in. And let's recognize that chronic pain, eating disorders, the addictions are all dissociative disorders. They are all disorders of having something outside one's whole sense of self that has to be brought back in and resolved to some whatever degree possible. And so this idea of gaining control over the uncontrollable, and I think that's why we see so many, it's the principle of the wounded healer, that it's the wounded healer in society who's undergone the trauma ritual, the traumatic experience, who struggles and strains. It's the hero's journey of making her way through the underground. It's the abduction and rape of Persephone, who emerges with the help of her mother Demeter out of the clutches of Uncle Hades to reemerge triumphant. By the way, having used a psychedelic Narcissus to move into the underworld and restore her control over her life, and the return of nature and the blossoms of nature that would nourish us.
That's so beautiful. And so I, I feel bad because I've taken so much of your time, but in terms of control, one of the beauties, I think, of your approach also is that, you know, food, diet, nutrition, these are things that we can control, or at least we have more control over than the more esoteric sort of psychological and emotional factors, possibly. I mean, we can try and meditate and we can do visualizations and therapy, etc. But food, there's something very concrete about it that we can sort of control and make choices every day. And I think that sort of ties in your two, you know, these two aspects. And there's something very satisfying, I think, about being able to control what you eat, if you can, without descending into orthorexia. But, you know, and it strikes me that people who have felt so out of control and traumatized without descending into an eating disorder, but, you know, being able to choose healthy nutrition for your brain is maybe one of the aspects of healing, is also that.
Absolutely. And, you know, orthorexia is often a phase, as you well know, when people are coming through the sense of being out of control. We see this in addiction recovery, for example. We see an overemphasis on everything must be under strict control, but that's often a phase as someone is finding themselves again. And you make a very important point. I think where we can find control in this world that's out of control in itself is very important. Can you put one foot in front of another and climb the stairs? Can you make yourself a nourishing broth or stew every day? And I do promise my clients, I said, if you do this day in, day out, that ritual of self-care, if you change your diet, if you begin to move, if you sit in the sauna, if you do some stretching, we continue to talk, I promise you, you will get better. I promise you.
I love that.
And I think we can offer that to our clients.
And that's a beautiful place to end. I really, really love that. Dr. Leslie Korn, you're amazing. Your website is drlesliekorn.com with a K, Korn. And thank you so much for your time. That was amazing. And I really appreciate it. And
The pleasure's all mine. Thank you.
Thank you. And I look forward to seeing you soon.
I will look forward to that, Kiki. Thank you again.
Thank you. Thank you so much for listening to the MindHealth360 Show. I hope that we've helped you realize that mental health symptoms have root causes that can and need to be addressed in order to sustainably heal, and have given you some ideas about steps you, your loved ones, or clients may take to start their healing journey. Please share this interview with anyone you think may find it helpful, and don't forget to subscribe to keep up to date with our latest interviews on integrative mental health. If you want further information, please go to www.mindhealth360.com or find us on social media. This information is for educational purposes only and is not intended to diagnose or treat any disease or to replace medical advice. Please always consult your healthcare practitioner before discontinuing any medication or implementing any changes in your diet, lifestyle, or supplement program.